Dr. Usman Khan is with Ozark Medical Associates. His specialty is internal medicine. And listen up, folks. If you've been wondering if you need to go in for a checkup, they have some good news for you during the month of October. Dr. Khan, I understand that your group is going to be offering free screenings during that month. Why did you choose to do that? I mean, obviously you want people to check themselves out.
Well, basically, the main reason is that when we started practicing here in this area, and especially in Southeast Alabama, what we realized that the common medical problems like high blood pressure, hypercholesterolemia, high cholesterol, and diabetes, mellitus, these common problems are most prevalent in this area, and it could be because of the dietary habits in this area, the sort of diet, you know. So it was very important and beneficial if we do that. We screen, like I have noticed that very young patients, you know, like in 30s, they come for different other reasons, and when I check their blood pressure, it's high, and they don't even know that they had high blood pressure.
It's one of those silent diseases.
Exactly, and of course it will, you know, manifest itself after certainly age 40, but it's very hard to control, and we sometimes have to use multiple medications.
So the next thing is to check this out. Now, you're going to limit it only in that you're not going to do adolescents. What's the age for people to come in for free screening?
After age 30, everybody is welcome after age 30 and onwards to come to our clinic and have this screening.
All right, so you're screened for what all you screen for?
Basically, just common medical problems that I mentioned before, like high blood pressure.
Fasting, if they have...
It would benefit a lot if they come fasting, but there is no restriction. I mean, we can still check the random blood sugar to check the diabetes, if it's you know, at a certain value, you can still diagnose diabetes mellitus. But if they come fasting, that would help us a lot to monitor the fasting blood sugar as well as the fasting cholesterol. And for high blood pressure, of course, they don't have to fast. But
so you need them to come in, you give them all these screenings, and then a recommendation, whether they come to you or not. If they need to get medical help, it would be life-saving and life-saving.
Exactly, because they would definitely need further workup if they come positive on screening, like the blood pressure is high or the random blood sugar is high. That needs to be further tested and reconfirmed by some other tests. But at least they would know that they have to go to the doctor, to any doctor. They can have their primary doctor somewhere else, but they will have some know-how of what's going on in their body.
And this is unusual. A lot of times it's just for senior citizens, but you're going to start out with younger people.
Like I said, we found that it's so prevalent even in the younger population. So it would be better to screen them as well.
Where is your associate's office located?
It's in Ozark, Dale Medical Center, it's a community hospital in Ozark. We are right behind the Dale Medical Center.
Okay, and do you have to have an appointment, or can you just walk in?
No, you don't have to have an appointment to come for this screening. You can just walk in.
Okay.
The office timing, between the office time and office hours.
And the office's hours are?
Monday through Friday, 8 a.m. to 5 p.m. We go for lunch between 12 and 1.
Okay. So this is an opportunity to have a checkup, absolutely free. They will do screenings for all these various things, and then you will find out if you have a condition. Why is it that people are in denial? They think, if I don't go to the doctor, I don't know. I want to know.
Exactly. That's one thing. You can call it denial, but people sometimes are afraid that if they go to the doctor, they'll find out different things that they don't want to know, because apparently they don't feel anything. Like high blood pressure, diabetes can present with some symptoms sometimes, but high blood pressure especially, and sometimes heart disease, is so silent in the early stages that nobody knows that's what's going on in the body, and they can say that, well, there's nothing wrong with me, why should I go to the doctor? But there are, these diseases can be screened and can be, the therapy can be started at early stages when it is more amenable and easy to control and easy to...
That way you won't have a heart attack or some horrible thing, a stroke happen to you. If you'd like to know more, you can contact Ozark Medical Associates at 774-1555. Our special guest, Dr. Usman Khan. Thank you for being with us.
Thank you for inviting me and letting me have this opportunity to talk about this.
Prevention is a lot better than cure.